Good evening, this is Viewpoint. I'm Zaka Jacob. After the centre's promise yesterday that there will be 216 crore vaccines by the end of the year, we now have the breakup of which vaccine provider will provide how much. Now, this includes 75 crores from Covishield, 55 crores from Covaxin. Also, new vaccines, biological E, Zydus Cadila, the intranasal vaccine and Covovax are all expected to hit the market between July and September. In addition, there will also be the Johnson & Johnson vaccine. Now, in all, India is looking at 200 crore plus doses between August and December. The question is, how realistic is this target?
अगस्त और दिसंबर के बीच में 216 करोड़ अगर हम इस सीन को लेकर चलें, डोसेज भारत में निर्मित हैं।
It is who is going to order for the big number. If we go to those companies and say that we want to buy 300 million, 400 million, this is the money, take it. They will give you.
All right, so rebooting mission inoculation. What is the detail now that we have in terms of how the government of India hopes to get to this 200 crore vaccines by the end of the year? Let's give you the breakup. Right now, the two vaccines that are available are Covishield and Covaxin. Let's start with Covishield, which is manufactured by Serum Institute. The target for Covishield is 75 crores between August and December. Right now, Covishield makes about 6 to 7 crores a month, hoping to up it to 10 crores. Covaxin, 55 crores by the end of the year. Right now, Covaxin manufactures under 2 crores, hoping to up that to 5 crores by July. Sputnik V, the first jab of which was given today in Hyderabad, 15.6 crores between August and December. In terms of the new vaccines, Biological E, the Hyderabad-based company, is expected to manufacture 30 crore vaccines. They are right now in phase 3 trials. Zydus Cadila is expected to get the clearances soon to hit the market by end of July. 5 crore vaccines between August and December. Novavax, which is the Novartis vaccine, which will also be manufactured by Serum Institute, they're expecting 20 crores of Novavax between August and December. Bharat Biotech's intranasal vaccine, for which again clearances have been given for the phase 3 trials, 10 crores between the 5 months of August and December. Genova, which is the only Indian mRNA vaccine, 6 crores expected in those final 5 months of the year. Now, this does not include Pfizer and Moderna, for which discussions are on with private channels. It also does not include any Chinese vaccine because top government sources have said they're not interested in any Chinese vaccine. So, how realistic is this target of 216 crore vaccines by the end of the year? Joining me on the talking point today, Dr. Anusha Rohit is Senior Consultant and Head of Microbiology at the Madras Medical Mission Hospital in Chennai. Dr. Joseph Brito is the ex-CEO of the Isabel Healthcare at Reston, Virginia in the USA. Neha Joshi, spokesperson of the BJP, and Dr. Shama Mohammed, spokesperson of the Congress Party. Neha Joshi, I'll start with you. Yes, we have some details now into the breakup of how India will get to 216 crores. But right now, we're looking at the month of May at less than 10 crores. If we need to get to 216 crores by the end of December, then we basically need to be amping up our monthly vaccine coverage to something like between 30 to 40 crores. Are we in a position to do that right now?
You know, this has been a work in progress. So even as we were battling the second wave of COVID, there was an interministerial team that was working and looking at scaling up vaccine production, that how could these two main vaccine manufacturers, could their capability be enhanced, could their facilities be upgraded, and money could be pumped in to enhance the infrastructure that already exists. At the same time, public sector unit, today the government announced that 3 public sector units based in Hyderabad, Maharashtra and UP are going to be roped in. Covaxin is going to share the formula and they're going to be manufacturing the Covaxin in India. So, from 1 crore, so a little over 1 crore per month by September, the Covaxin production. I'm only talking about one particular vaccine, and you gave a lot of details about the other vaccine that are in that basket. That production is going to be ramped up to somewhere around 10 crores per month by September. So the government is looking at importing vaccines. You mentioned Pfizer, Johnson, Moderna. These conversations are ongoing. Today, Dr. Reddy launched the Sputnik vaccine, and several states have already placed their orders. My state of Uttarakhand, we already ordered 20 lakh doses of that vaccine. So, India has already become the first country to vaccinate over 17 crore people in a record 114 days, Zaka. So the government is very consistently, very consciously working at the vaccine program, and that is in itself separate from the conversation about, the firefighting that we're doing as far as, fighting COVID is concerned. So this is, we are absolutely committed. There is a plan in place, and things are only going to get better as far as the vaccine manufacturing is concerned.
Well, let's see. At the end of the day, the government needs to be held to account for its word. So, Shama Mohammed, now there is a plan. This is not just stall talk. This is not just talking through the air, because 216 crores, now we have a breakup of which manufacturer is expected to give how much. And for example, I'm just taking the example of Covishield. This is very much in line with what Covishield had promised and what Adar Poonawalla had told in multiple press interviews just a few weeks ago, that they are hoping to ramp up to 10 crores by July and then eventually to 15 crores per month by the end of the year. So if they manage to do that, Covishield will get to 75 crores in the 6 months between June and December.
So how many people will die before that, Zaka Jacob? Can you tell me that? Do you know what is the situation all over? In UP, how many people are dying per day? More than hundreds. Bodies are floating in the Ganges. So my question right now is, what we need to do is save Indians. Now, how do we trust this government? The government
what would you do right now to save Indians? Do you have a plan?
Yes, the only way right now is to give compulsory licensing to private players. But there is an issue in that. What is the issue? The government files an affidavit in the Supreme Court saying giving compulsory licensing will be counterproductive. All right.
No, but government has also authorized 3 PSUs. What?
Can I speak, please? Did you interrupt that lady? Otherwise, I'll leave the debate, Zaka. If you do not want a Congress spokesperson, I will leave. Can I speak?
I'm just adding a point to what you said, Shama. I don't know why you're taking such grave offense.
Yes, I take, because every time I've come on your debate, I'm a bit tired. You keep interrupting me. You don't interrupt the BJP spokesperson.
I do, and you have known that I do interrupt BJP spokespersons.
I was listening to her, and you gave her time.
Finish,
let me finish.
Okay, go ahead. Finish your point. Yes, please. No, please go ahead. Make a substantial point.
Yeah. So on May 9th,
and stop making personal attacks.
Government filed an affidavit in the Supreme Court saying saying that we cannot give compulsory licensing. This is counterproductive. All right. Now then on 13th, the Dr. Paul says the only way is by giving compulsory licensing to private players can we ramp up the vaccine production. Now, who do we trust? Why do we trust this government? On the international level also, along with South Africa, they say that we cannot give patents. So what is the right hand of the government doesn't know what the left hand is saying. So the only way we can ramp up production, I am telling you right now, is to give compulsory licensing, and there's no other way.
So can I make the point that I was trying to make? Just adding an asterisk to what you're saying. The compulsory licensing which you're talking about has now been granted to 3 PSUs, one in Maharashtra, one in Uttar Pradesh, and one other PSU, I think based in southern India, as well as one private company which is in negotiations with Bharat Biotech. I just wanted to say that much. That's all I wanted to say.
What I'm trying to say is then why the affidavit in court? Isn't that contempt of court?
Why are you asking me? Ask the government.
That's what I'm saying. The government spokesperson is sitting there. You are trying to support the government. What my point is that how do we trust this government? On May 1st, we were all told 18 to 44-year-old everybody is going to be vaccinated. But what happens when the state governments are looking into it? There are no vaccinations. The state governments are trying to procure it from vaccine makers from around the world. But what is happening? One state is competing with the other state in our country to get this from internationally. They're procuring it directly. But the most important thing is these vaccine makers are not giving it to state governments. They are very clear that we are giving it to central government. And also, the most important point today is we have 130 crore population. We would need more than 200 crore doses, and we knew that from day one. Why did we order only 34.6 crore doses last year in 2020 when every other government top 5 vaccines.
let me go to the doctors because they're also waiting. Dr. Brito is there. Dr. Anusha is also joining us. Dr. Brito, is this a realistic roadmap that's been laid out by the government? Everybody agrees you need close to 200 crore vaccines by the end of the year to vaccinate the entire adult population. I think about 90 crore people need to be vaccinated. The question, though, is this just stall talk? Because given the record, and let's be realistic, from Jan 15, 16, we started vaccination. Today, we're just about hitting 18 crore. So to reach 90 crore by the end of the year, we need to be vaccinating at 5 times the rate that we have done up until now.
Zaka, thank you. Thank you for giving me the opportunity to add my voice to perhaps the most important post-independent decision that we as a nation face, the lives, literally the lives of 1 million Indians. So I think the number needs to be applauded. The sentiment and the intent behind the number needs to be applauded. But I think it's overly ambitious and optimistic. We need to focus on two things. One is just not the number. So 216 seems reasonable. If you have 100 crore Indians, which is 76% of our population, and you want to try and achieve herd immunity in 76% of your population, then 100 million into 2 for 2 doses per vaccine is 200 doses, and we should have some vaccine doses spare.
Yeah.
But the issue really here is the speed of vaccination. We need to carpet bomb our nation. It's not enough this slow creep of vaccination, the slow drip feed of vaccination. Because come September, October, November, December, that population which is under or unvaccinated, the virus is still spreading. And when viruses spread, they naturally, when they replicate, mutate. So it's not enough to do it slowly over 5 months. I think we have to, although it sounds insurmountable, we have to speed up. If in the 2019 general election, 615 million Indians voted in just 5 weeks at 1 million polling booths with the help of administrative EC staff of 10 million, if we can do it to elect 545 members of parliament, surely we can do it with the intent of saving millions of Indians' lives. But equally important to the speed and the rollout of vaccination, because it's not vaccines that save lives, it's vaccinations. So we do need to administer the vaccines mass, rapid, quickly. Is efficacy. All vaccines are not, there's an impressive list that you read out, Zaka.
Yeah.
All vaccines are not equal. We need to invest in high efficacy vaccines so that we get the maximum economic benefit. The lesson from Seychelles is salutary, and it's worth paying attention to all of us who make these decisions. 60% of the Seychelles, a small island nation of 100,000 people, 60% were vaccinated using AstraZeneca and Sinopharm. 60% received the Sinopharm, 40% received the AstraZeneca vaccine. And yet, they've had a second surge post-vaccination, and they've had to have a second lockdown. So we need to pay close attention to the vaccines relationships that we enter, the vaccine platforms that will start producing these 216 vaccines to make sure that they have the efficacy in place at the time when they're administered against the variants that are present at that point in time. And my last point, Zaka, please, is we do in tandem need to pay attention to gene sequencing. In addition to what I and many others like you have been arguing, that we need a central vaccine agency. We can't let 29 states, each of them, start negotiating with vaccine manufacturers outside of India. We need to have a central vaccine agency that's run predominantly by technocrats, including public health experts, because unless we are able to pick up, the second surge is being contributed by 2 variants, the 617, the double Indian mutant, and the what's called the UK variant, which is 117. And therefore, these entered the country in December and Jan. So when we do vaccinate our people going forward, we need to make sure they're not vaccinating them against strains that were present last year. We need to vaccinate them against emergent strain, and the only way of doing it is by real-time gene sequencing of the positive cases.
I want to ask Dr. Anusha, nobody is saying that vaccines will eliminate this disease. All that it will do is eliminate serious disease, possibly eliminate the need for hospitalization. So to that extent, yes, we need to vaccinate as many people and as quickly as we can. The question though is, and I think Dr. Brito was right, Dr. Anusha, that right now what we have is through government centers, or there are a few private hospitals across the country who are doing it. How do we increase the coverage? In the US, for example, they were doing it in Walmart. They were doing it in pharmacies. They were doing it in universities and colleges. They were doing it in community health centers. How do we increase not just the procurement of this vaccine? Right now, we have a supply side problem, and everybody agrees that's why the rate of vaccination, particularly in the last month and a half, has come down, because there isn't enough vaccine going around. If that supply side issue is addressed, as central government sources seem to be indicating, then the challenge is delivery. How do you ensure that every arm gets a jab? How do we increase the range and the scope of how the vaccines are delivered ultimately to Indians at large?
Thank you, Zaka, for having me here. And again, the other panelists have spoken very well on the part. But on the question that you have asked me, as you say, vaccine manufacturing is a very complex process. It is not something that is very easily going to be achieved. And now, looking at what we have at hand, we are having a projection of how many vaccines we may have at the end of the year. But what is important to understand is that as a country, I think the world has seen us as a very, very strong, a very strong leader as far as vaccination is concerned. And our biggest success story has been the polio vaccination program, where there has been door-to-door vaccination. Now, when we are talking, even when the previous panelists spoke about how we conducted elections, we are good at being able to conduct elections, or any mass program if we plan it well. And for that, we have a public health system. Like, for example, with the COVID outbreak, what we have realized is that the public health system is extremely strong and can come together at a great to a great level if given an opportunity. And that is what we've seen, that the public health people have done a greater job here than even what the private has been able to do. So considering that, I think what we need to do is, we have a task force that is looking at this, but what is important is that we plan to make it as accessible to people. There was a lot of vaccine hesitancy early, especially with the worry of what kind of reactions would take place post-vaccination, and hence there was a waiting period for half an hour. Now, there are many people who cannot leave their homes, like the elderly people who cannot leave home to come and get vaccination. And hence, these kind of problems have to be addressed with a plan where we will be probably having to do something like a door-to-door. But coming to all of those things, just to end it up, vaccine is only a short-term, mid-term solution, like you say. The Seychelles example is typically shows us that vaccination is not the key to save lives. Right now, we need to mask up. We need to have good COVID etiquette. We need to avoid congregating in weddings, in social gatherings of any sort, for that matter. We need to avoid being able to to be overconfident about not using the mask when you are at close distance with people, even if you are vaccinated. So there are a lot of things that we can do at a shorter level, which will reduce the impending, the movement of people across, various areas. These can help to reduce the, the pandemic levels at the acute phase.
I agree with what Dr. Anusha is saying, because there have been instances even of people who've got both the vaccines who've still tested COVID positive. But I want to come back to the numbers, and I'll go back to the political spokespersons, both Neha as well as Dr. Shama Mohammed. Neha, I just want to take one example of Covishield, which is of course the most prevalent vaccine in the country right now. If Covishield has to get to 75 crores between August and December, they need to manufacture 60 lakh doses every single day. Right now, they are manufacturing just about 20 lakh doses every single day. So basically, what you're looking at is a 3-time jump in their production. Is that even possible?
Well, Zaka, it is. The only drawback with Covishield is that we don't have the patent. In case of Covaxin, we have the patent. So hence the government was able to take that decision, tie up with these PSU and ramp up the production. There are talks that the government is on. The government is continuing talks with the manufacturers and if they can open up production in India and use the capacity of the Indian pharmaceutical industry to ramp up production. So that's an ongoing conversation. But I want to address 2 points that were mentioned by various panelists here. Shama Mohan made a couple of political points. I don't want to get into a political sort of fist fight here. Just one important point about procurement of vaccines. Zaka, you would remember I've been on several debates with you and other anchors where the Congress and its allies, they moved heaven and earth to say that central procurement of vaccines is actually becoming a roadblock, and hence all the states should be given the autonomy to procure their own vaccines. Yeah. And the center listened to the states and did just that. And now we hear cries of how this has become a competitive process and shouldn't have been done. If they get their act together and come together and say this can't be done, maybe the center will decide that it will go back to central procurement. So that's one. One very important point that one of the doctors made was that vaccines don't save lives, vaccination does. So I think the process of vaccination, how it's implemented, is going to make a lot of difference. So I see that a lot of states have come up with various strategies. They're looking at 24/7 vaccination in urban centers, door-to-door vaccination for the elderly and people with disabilities, vaccination camps for vulnerable populations like people who have been on dialysis, people who have recovered from cancer, other serious diseases. So these are strategies that states can implement at their level to make sure that the carpet bombing that the doctor mentioned, that they're able to achieve that in record time.
Okay.
So making vaccines available is the center's job, but I think implementing vaccination is the state's job.
I agree with you. Shama Mohammed, please answer that question. It was the states, and I think several chief ministers had written to the center saying, centralized procurement is not helping. You need to decentralize it, allow state governments to procure, allow private players to procure. The center did that, and now the states are coming back and saying, why are we asked to float global tenders? Isn't that a contradiction?
No, that was not the case. Nobody in the state said that we want to procure directly from external players. Nobody. The reason was the central government. Now, the doctor before the spokesperson, the Bharatiya Janata Party, just said that the polio vaccination was such a huge success. We eradicated polio in 2014 simply because there was a policy, a national policy.
Do you know how many years it took, Shama? Do you have any idea how many years did it take? Get your facts straight at least.
Zaka, come on. Listen, I don't want such losers to come and interrupt me. I'm speaking. I did not interrupt you, madam.
Mind your language.
Yeah.
Mind your language.
Shama, please, no personal attacks. Okay. Okay, she will not interrupt, but please, no personal attacks. I've got 30 seconds to wrap up. So please, if you have a substantive point to make, please make it.
Allow such uncouth people to be on debates here,
ma'am, if you have a substantive point to make, please make it, because I've got to wrap up in 30 seconds. Please.
Yeah, but if you don't want to invite me, don't invite me.
I have invited you, and I'm asking you to make your point.
My substantive point is when this lady came and interrupted.
No. To which you responded with a personal attack, which was uncalled for. But nonetheless, I'm giving you one last chance. If you have a substantive point, ma'am, please make the point.
So if your problem is not to able to control a BJP spokesperson, that's not mine.
Shama, please make your point.
So a national policy is there, and there has been 35,000 crore, which this budget, a central budget, has been allocated for procuring these vaccines. What has happened to the 35,000 crore? When the central government failed, it is given that to the states. That is what has happened, Zaka. That is the thing.
16 crore Indians have been vaccinated for free. That has happened. Maybe get your facts straight.
1.1% of Indians have been vaccinated. Get it into your head.
16 crore Indians have been vaccinated for free by the Indian government.
Okay. I got to wrap up. Thank you very much to all our panelists. That's a wrap. Like I said at the outset of the show, this is an ambitious target that's been put out by the central government for 200 plus crore vaccines by the end of the year. We'll see if that's been achieved or not by the end of the year. But we need mission mode vaccination. We need almost like wartime vaccination right now. The more people we can get vaccinated in as short a time as possible, the better off we are all collectively in this fight against COVID-19. Meanwhile, as COVID cases are rising, are on the decline in some urban centers, Delhi, Mumbai, etc., rural India and smaller towns are now seeing a sudden surge. Janak Dave reports from Gujarat.
This is the village of Sukhabari in the Vansada district of Gujarat. Corona patients forced to lie down on the ground to get treatment with just one doctor. Nearby, a public health center with no medical staff.
हमारे सरकार से ને એટલું કહેવું છે કે દરેક ગામમાં જે શોભાના ગાંઠિયા PSC CSC બનાવેલા છે ત્યાં અંદર MBBS ડૉક્ટર આપો, ટ્રીટમેન્ટ આપો, જેથી કરીને આ ગરીબ લોકોને ત્યાં ગામની અંદર સેવા મળી રહે, ટ્રીટમેન્ટ મળી રહે અને લોકો સ્વસ્થ થાય.
Amid the surge in cases, the state government ordered the formation of isolation and COVID care centers in each village, but it's a plan that remains on paper. Primary schools like this are being used to create COVID wards, but the conditions are abysmal. No facilities for patient care, testing or medicines, no patient ready to be treated here. According to the state government, there are 15,275 COVID centers in 18,000 villages. 5,404 patients are admitted in these COVID centers. Rural Gujarat has 47,826 active cases. 33,104 patients are in home isolation. There are no critical medicines at COVID care centers, there is low testing due to a shortage of kits, and it takes 4 to 5 days for results of RT-PCR tests. The state government meanwhile says the situation is under control and the surge is being tackled effectively, promising to ramp up the medical infrastructure and construct oxygen plants.
348 CHC સેન્ટરો છે. એ તમામ સેન્ટરો ઓક્સિજન પ્લાન્ટ સાથે ત્યાંની સ્થાનિક વ્યવસ્થા 30 બેડથી માંડીને 50 બેડ સુધીની થઈ શકે એવી વ્યવસ્થા, એનું સર્વે થઈ રહ્યું છે. કેટલી બેડની વ્યવસ્થા થશે અને કેટલા ટનના પ્લાન્ટની ઓક્સિજનની જરૂરિયાત ઊભી થશે, એ સર્વેની કામગીરી ચાલુ છે અને એ પ્રમાણે કામ કરવામાં આવશે.
But the situation is not improving on the ground. In the Chota Udaipur district, in the village of Kanlava, the government health center is locked. 5,000 residents of this village have been affected by the virus, but doctors come once a week for just 2 hours.
આજુબાજુ એરિયામાં કોઈ ડૉક્ટર એટલા વાર નથી, 15 થી 20 કિલોમીટરની રેન્જમાં. જે અમારે 10 કિલોમીટર અંડરમાં PHC છે, પણ ત્યાં બી જવા લોકો તૈયાર નથી.
કે ડોક્ટરો જો આજે લીધા હોત તો આજે આ મારી પબ્લિક મરી ના હોત. અને આ ડોક્ટર આજે અહીંયા ડોક્ટર નથી, પણ તેમ છતાં સ્ટાફ નર્સ પણ 24 કલાક અમને આ કનલવા ગામની અંદર જોઈએ, જેથી અમારે આજુબાજુમાં 10 ગામડા આવરાયેલા છે, એ ગામના માણસો અહીંયા લાભ લઈ શકે.
Even in the district of Sabarkantha, a COVID care center was opened in the village of Chitroda, but it only had mattresses on a dirty floor. Patients refused to go and so it was closed down. Despite the COVID crisis, villages across the state only have COVID care centers on paper. But on the ground, no doctors, no medicines, no critical care, while it's the Aam Aadmi that suffers again. Bureau Report, CNN News 18.